You have to have uninsured motorists in Florida. There is way too many people driving around with no insurance, no license, you are hanging out there if you get hit by somebody with no insurance. If you don't have at least some uninsured motorist, it is, you can be really, like the person who was in that 6 CT, you don't have insurance, you go to the ER, they give you 6 CT scans, you got a $25,000 bill, your PIP covered 8,600 of it maybe. They're like, okay, here's your bill. And you're like, I didn't even get anything. They just did scans. And they're like, they've sweetened the honeypot on go away money. Before it was like, no, 2,000, 3,000. Now they're like 5. I think they've realized we offer 5. A lot of people will just go away. Like cases. You know what I mean? They're like, oh, we'll just take it.
Yeah.
And you just, obviously, the world has definitely changed in auto. And that's something I was going to get into is, my practice being, I try to be diverse, kind of third, I guess you could say non-insurance, a third major medical, and a third PIP, which the third PIP has been the tough part, which used to be a lot more, but it is what it is. That whole world has changed a bit. I think like what you were saying, the marketing, I don't really have marketing events anymore. They're kind of gone.
Because there's none.
What do you mean there's no... Should I call my rep? And is there still a rep? That has kind of changed. And I mean, I don't know how that happened. I think when the tort reform went through, there was just a cascade of things that happened in PIP that I think it just fundamentally changed. Kind of like the 14-day. And what I look at that was, I think before it was years. You could have a couple years to file, right? So if you had 2 years, I mean, that's 104 weeks. So you go from 104 to 2. I mean, I would have brought to Congress, and I know Adam Sabin, who I'm sure you know, he went to Congress for us, our professions, to try to say, well, I mean, you can't go from 104 weeks to 2. What would be the reasonable? 50. How about 6, 8? The difference that they went to is, to me, completely unacceptable. And I mean, you can't even get a reply from an insurance company for 30 days, but you're supposed to know if you have an injury. Absolutely. So I think in turn, it should push people to come get care just in case, make sure, get an assessment. But really what it is 15 days, done. And
think about it too.
I think it's a disparage. I look at that and I don't even know how that passed. I just don't even, kind of like getting rid of the manual therapy massage with auto cases. I just go, I would almost, as a chiropractor, rather do some gentle manual muscle work, kind of work those tissues, and then work into the chiropractic a little more. I almost feel like that's, in the beginning, just kind of gently pushing that inflammation versus even adjusting, which I adjust routinely in the initial, but I just look at it and you go, who would ever approve that? You have
to think, there's also people who don't have, primary care physicians, and they put off medical care, right?
Of course.
So they're getting into this accident and they're like, okay, do I really need to go? I mean, it's a completely whole new world. So you've got those 14 days, and that, like you said, I mean, that is nothing when it comes to the grand scheme of things.
You're afraid your insurance is going to go up. Oftentimes, if you have concussive symptoms, you're confused in general just with your daily activities. I actually went to Congress for many years, and I went when this 14-day thing was coming in, and I was told by our own state chapter, I prepared questions and looked how people voted, and I was like, oh, here's what I'd like to ask this. They go, no, you can't ask that. I go, well, why can't we ask why they voted like they did, especially if it was adverse to our treatment? They go, you're the smiling face of chiropractic. And I go, well, but they did this and it wasn't good for us. If we don't at least address it with them and at least express that we're not happy with this decision, which they already know, there is no accountability for it. So I actually was told to kind of sit down and, zip it. And now the person who did the research, the person who was going to hold a couple feet to the fire, I don't go. So who's left going? The people who are smiling face of chiropractic. And you go, well, I mean, I'd love to smile, but, if these things affect our treatment of our patients, we have to at least address it and address the fact that we don't feel like this was an appropriate. And most of the people I talk to, they're like, yeah, well, definitely massage is nice with a car accident. You go like, well, didn't you vote against it? And,
Makes you think.
It was very frustrating when I was told to not even ask questions when these things were happening. And you go, well, then how is it? And this is why we see the medical loses a bit, and then the attorneys lose a bit. Then they go back to the medical and lose a bit, then they go back to the attorneys. They're basically, it's death by 1,000 cuts. It's a very interesting, and I've been doing this now coming up on 2 decades, and just the differences from the beginning to now is very interesting.
Yeah, it's night and day.
Anyway, okay, so I know you have a flow we got to go with. I just start talking.
Yeah, no, that's okay though. But obviously something that, you're passionate about. And obviously the PI world is so niche, not everybody understands the day to day and going on, obviously. And sometimes people don't understand unless they've been into an accident, unless they, work in this field. So I wanted to talk to you a little bit more about you and how you got to becoming a chiropractor and how you made American Chiropractic what it is today.
So I kind of finished through high school, and I had good grades and, involved in a lot of sports and all that. And I just knew I wasn't quite ready. So I actually joined the Army. Most of my family have served.
Thank you for your service.
I was a forward observer for the 101st Airborne Active Duty, which, to be honest, I'm big into math and physics. As a forward observer, it's the perfect fit, So I actually got to use a lot of geometry and mathematics in the military, which then I got out and I joined a kind of a 5-year program where you get a degree in engineering, physics, and then a minor in mathematics. And I had already been caregiving a bit for some relatives and stuff like that, so I knew I was had that propensity
special touch
for caregiving. Yes.
Yeah.
And a friend of mine in pre-med goes, well, you're doing biomedical engineering, are you sure you just don't want to be a doctor? And I go, that's a good question. So I went to night school and became a chiropractic assistant, which a certified nursing assistant. Worked in some nursing home stuff, and I joined the Gunderson Lutheran, which is part of like Mayo up in Wisconsin. I started working night shift, and then the day when I could, I was a full-time student and working. And what that allowed me to do was to shadow different doctors. So I'd be working on, transporting patients, patient care, all night. And then I'd come in during the day with a shirt and tie, throw a white coat on, and I'd be walking around with the doctors. And some really interesting interactions happened with the patients, and I just realized I love being face-to-face with patients. I would like to work faster, but if I have a child in my office, I get down on their level. And I want them to be comfortable. I want them to see that being a doctor, coming to a doctor's office can be a good experience, not scary. And I shadowed orthopedics, which I really liked orthopedics. A lot of OR, and being prior military, once I started to have people dying in my hands, doing chest compressions and CCU, and the nurse puts her hands on yours, and you can stop now. This little lady's ribs are broken, and you like to think in your head you're stopping because they're good, but you're stopping because they passed away. And then one of my jobs was to take people to the morgue. So that full circle to me, I kind of looked at it and I said, do I want people dying in my hands? do I want that? I was in surgery and, a lot of blood and guts. And
I was going to say ortho surgeries are very gruesome.
Yeah, well, to be honest, I was doing a hernia procedure, shadowing, and the doctor's like, help push the intestines in, and I'm helping hold the intestines, and I'm like, how do they know where to go? And he goes, they just know, and you're stitching this, and you just, and they're like, well, you get used to the smell of cauterized, skin with the blood, and I go, do I want to get used to that? Is that what I'm supposed to do? And I kind of left that, and I shadowed a maxillofacial surgeon for quite a while. I took the dental admission test. I mean, I'd be living on the ocean right now if I'd done that. But you just kind of watch them say, open a little wider, open a little wider. No one's happy to really come in. And I go, the money's there. It's great. I'll probably end up being a plastic surgeon, which is not really what I wanted to do. And my grandmother, ironically, goes, you need to come shadow my chiropractor. And I was like, what is chiropractic? I was on the MD side, so there is nothing else. To an MD, there's like DO. Now it's kind of balanced. I've been doing this for a while, but when you were shadowing doctors, there was just one. There was an MD, or you're just something else. DO was kind of there, but there was no doctorate of physical therapy. There was no doctorate of personal training or just
physical therapy and stuff,
which are good. They're good.
Yeah.
So there was not, and I just shadowed this chiropractor, and I go, this is what I'm supposed to do. Well, I loved seeing the patients come in and their lives changed, and I asked the doctor, I'm like, okay, like, is the education legitimate? Like, is it the level of medical school? And he goes, you're gonna hate renal anatomy, and I go, perfect. That's what I want to hear. I don't want to hear it's easier than somewhere else. I want to hear the standards are as high, if not higher. And the education's fantastic. So I was like, that's it. And I was kind of ostracized, actually.
Really?
I was doing research. So basically, I was doing the mathematics for a master's PT program, doing pre and post muscle failure assessment. Basically, this is many years ago, and the doctorate of PT didn't even exist. And this professor was kind of thinking of me being that as moving into biomedical engineering or orthopedics. And so I joined this second level master's class doing their research, and I come in and I was like, Doctor, I won't use his name, XYZ. I was like, I found the perfect job. You're a doctor. It's kind of not, it's holistic, but it's still major medical. Like, and he goes, you're kidding, right? And I was like, kidding? Like, no, it's great. And he goes, throw your research away if that's true. Don't come back. I'll give you an A.
Oh my gosh.
And I go, now the airborne infantryman, I kept inside when I heard that because I was very frustrated as a very hardworking. This girl and I created a biomedical physics program at our college so that you could qualify for pre-med with a physics degree. We did it.
Wow.
And he just goes like, no, throw everything away, don't come back. And he didn't want me on the research if I was going to be a chiropractor. So I think these days that would blow up and be viral and he'd be in trouble.
Of course it would be.
I kind of walked away and I got an A. But it made me question. And for me, I've been a person that in the face of adversity, I work harder. The world is great, but it holds you. There's so many things to hold you back and push you away. And that's when you got to push through and just put another foot forward. And I go, no way. I know this is what I'm supposed to do. So went up to chiropractic college, had a great experience.
Where did you go?
I went to Palmer Chiropractic, Florida. So I was actually the 5th graduating class, which I went to Los Angeles and toured a school. I went up to Minneapolis. I looked at Davenport, Iowa, which was close to where I was from. I'm a Florida guy.
Yeah, I was going to say, no.
I like the sun, and I enjoy winter sports stuff and all that, but like,
this is where it's at.
You want to ride your bike to the beach, and it's beautiful.
Exactly.
I don't like a whole month of sub-zero, no sun. So I saw Palmer, Florida, and a couple of the people that I had seen that were very, very successful, they were at the precipice of an educational growth or experience. A guy invented the semiconducting microchip. Well, it didn't exist. So, like, I looked at this and I knew that this school would be trying harder than ever to make it work. And now it's like 4 buildings. When I was there, there was one.
Oh, wow.
One in like another building they were using, and now it's huge. But I knew that all those professors, all those people in the academics, all those people on the student support side, everybody was going to have to work that much harder to make this educational process happen versus 100 years of the same classes. So it really was a great experience, and I had some really fantastic professors. Not all, but that's okay too. You gotta, and that's what I was gonna say about I worked somewhere and I realized I left a 2-year contract. The guy wouldn't pay me what he was supposed to, and he said, "I won't." And I go, "Well, you have to. It's in the contract." He goes, "Well, you won't quit." And I'm like, "What do you mean I won't quit?" He's like, "You have a newborn. You can't quit." And I go, "So because I have a new baby, you won't pay me what you're supposed to?" He's like, "Yeah." And I was like, "I'm gone."
This
So
is
I
a first job after graduating from
I'll
chiropractic
never
school?
be like that. I won't have a practice like that. I won't manipulate like that. I said, I will have a practice that'll be ethical, deliver the best care that I know how to give, and keep learning. I took from the good and the bad from that experience. I like to say you can learn from the good and learn from the bad. You know, we don't want to just throw the bad out. Learn from that. You know,
Yeah.
You can't have a peak without a trough. You know, so it was hard. It was very hard in the beginning, and not to get too far, but it was right before the Affordable Care Act. So I had getting paid really well for almost a year. And then all of a sudden they're like, yeah, we don't pay that and we're not paying that. And you only get this and you don't get that. That's not covered. That's not covered. And I go, wait a minute. And they go like, oh, you must have not got the memo. So then you took about a 35-40% pay cut. And I was like, what? And then you go, well, the only thing that's really bringing in significant reimbursements is auto because it's double Medicare. You know, which, like I said, I like a diverse practice. So I like this week I've seen, I saw it 4 weeks that we were at 3 months, 4-year-olds, 3-year-olds, 9-year-olds, 82-year-olds, you know, I like the diversity of the practice. So
Yeah, you don't have the same day every single day.
And then I opened one more at the beach, and I loved having 2 practices, but the overhead was crazy. Then COVID hit, and COVID was destructive. I mean, I guarantee you, for you all, it was as well.
Yes.
It was just survival mode. And then they're like, okay, you can open. And you go like, yeah, well, I haven't been able to like work. Like, you have to build. It was like starting over. And I had to just step back, and some things happened in my life. And I just said, I can't be with my kids as much as I want working this much. So I closed the beach clinic, and I kind of do like nurse shift. I do like all day Monday, all day Tuesday, all day Wednesday, Friday afternoon, and Saturday morning. And then I have today off, tomorrow off till 2. We're coming in early for the basketball team. And then, you know, it's kind of like I can just spend all that time with the family now, which you start chasing it, you know. And at some point you got to realize sometimes just because you ran faster, the carrot on the end of the stick, the stick didn't get shorter because you ran faster. You see what I mean?
No, I do.
So it was an interesting, and now I'm kind of really we've added working with the basketball team, which has been
And I definitely want to talk about that too, because that is awesome.
Okay. And I told you I might run on a bit, so
No, that's okay. No, you're very passionate about this too, and which is why I knew that this was going to be really good.
Great.
But when you talk to me about that, because it's not, is it New Wave? Remind me the name.
Oh, the Wave.
For the basketball team.
The Wave.
The Wave. Okay. Yep. Okay. So how did that come about?
So, you know, I've kind of worked a lot on put energy, good energy out, get a good energy back, kind of stuff, which isn't easy. That's something. Staying grounded for people is not easy, and understanding and energy stuff. So, a friend of mine that I've been a long time friend with, his neighbor is the coach, and he goes, "Hey, I met this coach. They're talking about the basketball team, and they need a chiropractor. And I mentioned you." And I met with the coach Jess Boji, and I mean, I just right away was like, wow, this is great.
You knew it was a good click.
And then we met with Taj, who's the president of operations, like I think 6-7-time Hall of Famer, or Hall of Fame 6-7-time champion. I don't even know. Like, just, I'm not an awestruck person. I'm not somebody who, but we sat down and ate, and all I wanted to do was listen, because she broke glass ceilings. She was the one who put women's basketball. She went through the tough times. Now they're getting good contracts, and we have development leagues coming in. So I was actually a little like awestruck, and went to shake hands, and she gave me a hug. And I'm normally the over hug, and I was like the under hug. She's like 6'4", 6'5". And one thing I asked is, do you want a female chiropractor for a female team? I mean, I would be offended by that. I feel like I need to address that. And they go, no, we want you. And I go, okay. And so then you kind of meet with the business side and set up the contract, basically, which I could get into all that. But it's kind of you can use some of the insurance, but a lot of it's just the advertising. You mentioned Chris Campione, he's big with, Andy,
I know, I talked with him about that too.
Yeah, Andy Kaufman and the Iceman, same owner of Wicks. And this has a quick expansion planned, but to be honest, it is such a breath of fresh air working with these athletes. It is. I mean, my kids are at the games. I see the energy. I want it to be busier, of course. Tough first year, but I see the Jacksonville community stepping up, and I don't know of a better reason than women's sports. I mean, the whole country's behind, but Jacksonville had an opportunity to step up and be a leader in the female sports community, and I feel like they're doing it, and it makes me proud. We have the Giants back in the day. We have the Icemen. We have Jumbo Shrimp. But finally, with some of the new female WNBA, and finally starting to get paid right, I watched the game the other night with Fever and Dream. That place was packed out.
This was where was this?
That was up in Indiana.
Okay.
But, I think we have that potential as well. And it's a little different working with real-time injuries. Kind of like, obviously, a car accident, you have a real-time injury, but, it's a little different. You have to, which we're going to get into what needs to happen there. But this is like, I'm sitting with Mayo Orthopedic. We're triaging shoulder injuries, ankle injuries. I opened the clinic because I noticed right away I wanted to have times just for the athletes. So basically, I go to the game, I treat before, during, and after as needed. But I also opened up the clinic because I had closed more. I gave an opportunity to just let the players come in. Players, teammates, coaches. I kind of said, anybody who's helping these athletes, I want to help too. So I opened it up to the coaches as well, which I've now been talking a bit with the Florida State College basketball coach, Jessica, and I might go work with them a little bit, even if it's just information on chiropractic and sports injury. What I noticed with a lot of these athletes is they just don't know a whole lot about, they're really good at being athletes, but injury recovery, protection, stabilization, I mean, the first 4 players, I think there was 10 knee surgeries and 2 full ACL tear, or 2 full Achilles tear. You go like, wow, that's a nasty little start for those, So, so it's it's very different, treating, areas that have had 3-4 surgeries, for example. And I'm always wanting to learn. So I'm sitting there, I go, please, Mayo Orthopedic, like, I want to, I was kind of like a little kid. I'm watching the orthopedics go through the, ankle exams, and you can see that one of them had rolled an ankle, and you could see some ligament laxity. And I'm watching, just being quiet, because I'm just enjoying watching,
like a kid in a candy shop.
Yeah, well, I've worked hard to get chiropractic kind of on a level where you treat patients. I release patients. I tell people they get better. One thing with chiropractic is you go.
I was about to say that doesn't happen with everybody.
Yeah, the stereotype is once you go forever. And I tell people, well, that's called supportive care, maintenance, wellness. You came in for sciatic and it's gone and you feel great. Congratulations. We can discuss supportive care if you need it, if you like it, if you want it. But my job is finished when you got better. Now, I can have another job of health and wellness and discussing what that means and stability and this and that. But I have a responsibility to tell you when the injury is better. Similar with an auto accident. I tell many people, best case scenario, I find nothing in the imaging and you just get better. You cannot replace your health with money. But if you're injured, we will not miss it. We will make sure, and we is a team, an orthopedic, neurology, pain management, chiropractic, physical therapy, it won't be missed. I would rather have a study that showed there wasn't anything there than did, but I'm not going to miss anything because it's too important, which I know that's something we were going to get into is why is it important? Well, you don't have to have a ton of symptoms to have underlying injury. And a lot of times if you have concussive symptoms going on, you're not even, that will kind of take over. It will take over. And you're not even paying attention to other things, If you don't really have a history of headaches and all of a sudden you have severe headaches after a car accident, your life has changed. If you have migraines and you're used to having headaches, that's not going to be pleasant, of course. You're like, oh, my headaches are worse now. But you understand headaches and migraines and how to deal with it and medications. If you've never really had headaches and you have a significant headaches, post-concussive, concussive, neck sprain, strain, disc injuries, especially higher cervical, and you have a chronic headache for 2 weeks and you've never really had a headache, your life came to a grinding stop. And that's when I tell people, well, we have to make sure, I have to explain to people kind of how a concussion works. I didn't hit my head, and I go, well, did you jammed forward.
You got whiplash.
Your brain is in fluid, and your brain hit the front, and then your head hit the backrest, which your head stopped, but your brain is moving around in the cerebral spinal fluid, which creates concussion. You don't have to hit your head. A lot of times you'll see it if you get T-boned from the side. You'll have a shoulder, kind of slap tear shoulder injury, and you'll hit your head. So very, very common, obviously. And even airbags deployed. That doesn't mean that you don't have a concussion. A lot of people think, well, the airbag deployed, and you go like, did you get burned? Well, yeah. Did you have, seatbelt, this, rib injuries or anything? Well, yeah. I go, well, that was definitely enough force to rattle the big organ in the head,
Yeah.
So we don't know that, though, until you have a scan, and if it's clear, great. If it isn't, well, you're going to be seeing a neurologist, a brain specialist, something like that. I think chiropractic is one of the most important things for me is initial care, but by the time I do a re-exam, I want to have imaging done. It doesn't mean more might not need to be ordered, but imaging done and my referral out.
That makes things so much easier.
Yes. And there's oftentimes personal injury benefits remaining, which is nice. That's just great for the place I refer to. They're much less apt to get you. Well, they'll get you in anyway. But, by that first re-exam, by around visit 10, it's all laid out most of the time. We'll have the MRIs needed. We might need more. I spend to, we have a disc and I send to a neurologist. I'm trying not to use any names or anything, And they're like, okay. Yeah, we definitely need a DTI brain scan. sometimes I'll do those in advance, especially if I'm seeing, you all see concussive patients. So,
Yeah.
it's pretty quick for somebody who's trained in concussions to tell somebody's having a concussion. You
Without
just
a
start
doubt.
asking questions and you go back to there's a lot of pretty straightforward protocol for concussions, but the main thing is establish the level of it. I have a case right now, and the young girl is terrified. It was a really pretty bad accident. She needed the brain scan, but I needed to have it because her anxiety that something was wrong was ruining her life. And I'm like, okay, yeah, you definitely have a concussion. Let's get it in. I'm like, you already have a CT scan that's clear. So we know there's not, they did one at the ER, but hers came back clear, which is fantastic. And, the next one doesn't. And I, as a chiropractor, if you have a concussion, I have to co-manage.
Yes.
If you have pain that's not resolving, I have to co-manage. I prefer every single case. I want an MD, a DO, nurse practitioner, looking over my shoulder going, yeah, what he said. Or I think this might be happening too. Great, let's,
all work together. Yeah.
Yes. In all because of it's a team to get this person better. And ultimately, if you are hurt, you need to get properly compensated for it. So it is crucial to document. The girl I had in the other, I was kind of she had the clear brain scan, but during the exam, she couldn't keep her head up.
Oh no.
She kept laying down and putting her head down and okay, now I'm recognizing that happening, but if I don't document it's happening, it didn't happen. So in my exam, I'm writing repetitively the patient had to lay down to rest due to her concussive symptoms, headache, and neck pain. That is a functional assessment. That's not you see what I mean? Activities of daily living and stuff like that have to be documented. And a lot of times that gets overlooked.
It does.
Yeah, yeah.
Anyway, and especially if you have so many hands.
There again, sorry.
No, but that's okay. And I was going to say too, since you have all these specialists who are all working together essentially to get this patient back to normal, and we see it too whenever we're getting referrals our way, looking at all the documentation, that the physicians are then going to be reviewing. Yeah, that is very, very, that is key, especially to continuing on to building this case. But to kind of add on to that, when you were talking about, you've got a neurosurgeon, orthopedic surgeon, let's say a neurologist, physical therapist, chiropractor, who is all working along to get this patient back to normal. When do you feel, with you treating them majority of the time in the very beginning, when do you feel, as it's a good time for them to be then kicked over to a specialist after, you've done chiropractic adjustments?
So I'm probably a little, well, maybe I'm not unique, but I refer almost every case.
Okay.
Well, a lot of patients are terrified of injections. A lot of patients don't want to take pills. So those are great options, but a muscle relaxer, meloxicam, a steroid pack, even maybe some tramadol. I want my patients to have comfort. I don't want them to sit in pain for 3 weeks while I'm trying to get chiropractic moving and get imaging done. The faster we can get pain and inflammation down, the better they're going to feel. So I tell my patients when I refer them out, you're going to go in and discuss options. You choose which options are right for you at that point. But in order to make the most informed decision, you got to know those options. And that's why I tell a lot of people, you brought up neurosurgeon. A lot of times I tell people, I want you to get a neurosurgical consult for this significant disc herniation because when this case closes, this is your life. And I don't ever want to look back and go, wow, I wish I would have known all the options. Because if a neurosurgeon says, you don't need it, that's really good to know. That's very good for that patient to move forward. If the neurosurgeon says, I think you'd be a good candidate, well, then that patient goes, okay, well, now do I want to do it or not? You know what I mean? And a lot of it depends on how the pain management's working. But then they go, well, how long do I have to do pain management? And I go, so, there's an interesting question. And we don't really know that answer because this could just get better. This could continue to be a problem. And, I feel like you can never go wrong talking to another physician and giving their opinion on how to get this person better. It just, the better informed you are, the better decision you can make. So I send out, now, at fault accident, little whiplash getting better, we have a clear MRI, and they're not feeling bad. Take 4, 6, 8 ibuprofen,
Yes.
And obviously the bills could mount up. Even I had one the other day, good old Memorial, 6 CT scans. I'm like, you got a $25,000 ER bill. I don't even, you got a 10, 20 bodily injury on the other side. I just go like, we're going to figure this out right away because if you don't have major medical, you're going to get a great big bill. And that to me is something that I take very seriously. I don't like the idea of, obviously the settlement needs to take care of the client. Everybody else needs to be taken care of, but I like the client to get at least a third. You know what I mean?
Yeah, we're the same way. We feel the same way.
Yes,
yeah.
I agree completely. Yes. Well, and with integrity, you have a shoulder injury, a knee injury. I'm a chiropractor. If you have a partially torn medial collateral ligament and a torn meniscus, that's not my wheelhouse. Like, in no way, I can do passive therapy, some mobility work, stuff like that, but you got to see an orthopedic. And you're going to need, if you're not surgical, you need to do PT. If you're surgical, you need to have a very serious discussion.
Yeah, without a doubt. Especially while your case is open,
Correct. So for me, I don't hold like that. I think that's why a lot of people, like I said, the PIP world has changed.
I know.
I feel like my very straightforward way of doing all this is what will pay off. We're seeing right now, very interestingly, we have extremely good reviews, which I am beyond blessed for. It's kind of something that just is very rewarding for me to read patient reviews. And I tell anybody, if you're curious of who we are, go read some reviews.
Look at the reviews.
You'll see it. But with AI, the marketing is being extrapolated out. Because if you ask, who gives the most personal care, spends time, tries to find the right treatment for me? Well, the marketing is gone. It's going to look for what you say, what your reviews are. I've had several, it's becoming much more common where, how did you find us? AI, ChatGPT, and I go,
yes, we've actually had that recently too. It's honestly crazy how this is happening. Yeah, and so I even tried it for myself. I'm like, okay, so then I just, I'm trying to find a neurosurgeon, in town who will see me after an auto accident. And, Integrity was like the first one. And I'm like, maybe this is like a I don't know,
Freudian,
or whatever. Yeah. And so I asked my husband too, and I was like, can you look this up on ChatGPT? And what do you know? It came up. So, and even from, doing these podcasts and having them on YouTube, we have also learned that AI is grabbing from YouTube as well.
Oh, wow.
So it's still mind blowing to me. Yeah, it really is. It's such a cool thing. Honestly, there's a lot of jobs, I'm sure. Maybe one day they'll be taken over from AI, but one thing is going to be chiropractic. That's not going to happen.
The interesting is how it's going to affect marketing, because they're going to have to figure out a way to circumvent that to make the marketing effective.
Yeah.
You want to be, top spot with Google Ads. Well, that's great, but they're not looking for that spot. If you use ChatGPT, you see, so it's kind of an interesting, and I'm seeing a lot more than move to social media, and it's just get in front of their face as many times as possible, which, let's be honest, the billboards in Florida, the people on the billboards, it worked. M&M, obviously I don't need to get into names, they've become the name.
Yeah.
Yeah. They're like, oh, I know who I call. And you're like, well, how do you know who to call? Because I've seen
the
some
billboards.
advertising. You go like, yeah, well, I tell everybody, the best person advertising will do good probably in business, but it doesn't mean it's the best business. They're just good at marketing, which is a good thing. Hey, listen.
Yeah.
You know. So very interesting offshoot there. I'm happy to hear that you've heard that as well, and that speaks volumes for Integrity.
Yeah, we just don't want to be behind on the times, I think. I think that's something that whenever AI first came on,
Totally
we were kind of like,
I
a little
resist.
bit.
I resist.
But you start
way
to
too
think,
much.
though, you're like, okay, well, where's this going? Because even before with marketing, we were doing a lot of the Google SEO, and then whenever we started this new company, they're like, listen, Google and stuff like that. Yes, people are still looking. But I mean, even me, I'm in my early 30s. And when I'm searching for things, I'm going to social media often. I'm not always doing Google. And so there's like a tie on that with AI. And so when they were talking about YouTube, it really is really cool. So blows my mind.
Which is why I was so excited about this opportunity. And I'm thankful again, Mackenzie.
Yeah, of course. And one thing too that you brought up when you were talking about, speaking with the patient, whenever it comes to their imaging, one thing that is very admirable to you as a chiropractor is you're seeing your patients more than once a week, right? Or maybe you're just seeing them once a week, but you're seeing them often, and there's so much trust.
I start at 3 times a week.
3 times a week.
Once in a while too, but yeah, 3 times. It's just a good number.
Yeah.
And documenting. How is it affecting their work? Are they able to work? Do I need to put them on a work restriction, a full work restriction? Well, I went to work and they can't do light duty. Well, then that means we're going to have to do a full work restriction. Well, if I didn't see you for a week, you just dealt with it. You know what I mean? And a lot of times there's FMLA and stuff like that. So, and, the passive therapies are often the most important in the beginning. ICE. And we were getting into these, what do we need to do? And I'm an old school RICE guy. I'm assuming you know what that is. Rest, ICE.
I actually don't.
So the acronym back in the day, you have an injury, sports injury, any kind of injury is RICE. Rest, ICE, compress, elevate.
Elevate.
And then I say NSAID. Ricin, which is
Ricin.
but and an NSAID because obviously it'll help the pain, but I tell people a lot of times the NSAID's not just for the pain; it's to get your inflammation down.
Yes, big time.
To get the healing process starting. So, with auto, a lot of times I tell them if you go to the ER, you probably have medications prescribed. If you've already seen somebody, you probably do. But I tell people don't be afraid. Now, obviously, I got to check the history. Tylenol, ibuprofen, interaction stuff, but. Don't be afraid, even if you just take one Aleve every 12 hours, just to fight the inflammation. It will help your pain as well, but I'm combating the inflammation as well. A lot of times what we see in MRIs is inflammation.
The inflammation.
Edema. Yeah. So, even though my wheelhouse is small, I would love to be able to prescribe a couple things and do a cortisone shot. I'm glad chiropractors can't. I think that would just, every person would need everything, and that's the reason we do our job. And if they need those things, you refer to the people who do that job.
Yeah.
So I would love to be able to prescribe a muscle relaxer, a meloxicam, and do a steroid injection, but
that's whenever you kick it over to us and we can take care of that.
Yeah, exactly. Well, and that's the point. But a lot of people, chiropractors are like, they're mine. And in order to give the best care, you got to do what's best for the patient. Mm-hmm. That's just the fundamentals of it. So, this is with attorneys and stuff. They know I want somebody to say, yeah, what he said. It's always a good thing to have somebody overseeing what you're doing. Even my office managers, my mother, every exam I type up and send out, I have her proofread. Read it over. Just make sure I didn't put American Chiropractic twice or something, Just any little, you understand with personal injury, any little thing can be the hinge pin they're going for, Once you get a couple depositions,
something that they can harp on.
You start to find out they're trying to, if we had time, I had a crazy deposition not that long ago, and it was so frustrating. I got set up, and my attorney didn't have a clue what was going on, and it was kind of astounding. I'm very, very rarely surprised. I'm a very, I filled out the question. I actually redid your questionnaire, or your kind of like outline. I kind of opened up the space and put some notes. Well, I just wanted to be prepared, and I haven't even used it anyway.
No, I get it. Yeah, which is what I figured was going to happen.
Yeah, real quick, the patient had an accident, right? 2000, maybe 12, right? They had another accident over 10 years. It was like 2004. Their records were gone. I mean, that was over 10 years ago. I had destroyed. I keep a lot of PIP. I keep basically all PIP 10 years. That's a little more than the statutes, but so I didn't. All I had was their exam saved on a hard drive. You know what I mean? So I had the exam. So I go in. We're doing the depot, and towards the end, the attorney they did a good job. Not my attorney, not my client's attorney. And they go, oh, so let's talk about, her treatment from the previous accident. And I'm like, well, all I have is the exam where I can discuss it. She goes, well, I have the records. And I go, you do? She had my records that were destroyed from 2012.
How did that happen? Was this just whenever they were gathering all of your records from previously?
Don't you have to provide those to my attorney?
Yeah.
So, and my attorney didn't even know that she had them. And I go, oh, my God. And it gets better. So, the nice thing with me is I have nothing to hide. So, I knew what I have a pretty, I'm not quite photographic. I don't want to remember that much, but I have a pretty good memory. And so I went through that pretty easily. But that was a huge surprise. Then at the end, she goes, oh, well, the opposing counsel goes, oh, by the way, so did you know that the patient had another accident between those two? And I go, I wish I could have screenshotted what my face looked like, because she dropped like a stink bomb in my lap. and I can't believe my attorney didn't even say anything. I was like, and I go, there was an accident between the 2012 one and the 2023 one? And she goes, yeah. And I had no clue. The patient never told me. The attorney never told me. I never even knew. I've never had I've had some brutal, I don't know if you've been in on any depositions. I'm sure a lot of the physicians have, but they're brutal. I mean, they're setting you up. They're trying to ask long questions of what one-word answers, but I've never had an attorney on our council completely unprepared.
Drop the ball.
Yeah. It was a very, and I was just like, I can't imagine what my face must have looked like when I go, wait a minute, you're going to tell me that there was because in my mind, I'm like, the client lied to me. I don't want to say that in a deposition.
Yeah.
But in my mind, I was like, so what year was that at? In my mind, I'm like, so what year was that at? I want to ask questions because that messes up my history. You know what I mean? I'm frustrated because my history's not right. So yeah, but what do you know? The case still hasn't settled.
And this is from 10 years ago.
Well, they had a new accident in 2023,
Okay.
I think it was. I treated them that accident, and I treated them the one in 2012. But came in 6 times, and the last visit said, I think I'm as good as I'm going to get, and never came back. And you go well, that's not a good way to end a case.
No, it's not.
No resolution. And then they lied about having another accident in between, and you go
I know, you're I'm just trying to help you. Can't help you if you can't help me.
Well, and I've never seen an attorney less prepared.
That's really sad.
You didn't even do your due diligence at that point. Anyway, I went on a tangent again, but that's just kind of one of those just crazy stories of you need to understand in Florida is you have to have uninsured motorists in Florida. There is way too many people driving around with no insurance, no license, you are hanging out there if you get hit by somebody with no insurance. If you don't have at least some uninsured motorist, it is, you can be really like the person who was in that 6 CTs.
Yeah.
I mean,
there you go.
Car accident, you don't have insurance. You go to the ER, they give you 6 CT scans, you got a $25,000 bill, your PIP covered 8,600 of it maybe. They're like, okay, here's your bill. And you're like, I didn't even get anything. They just did scans. And they're like, yeah, you owe us $18,000 or something, you know?
Yeah.
Well,
and it's like for them too, it's like not even your fault.
Policy there, you know?
Yeah, especially if it's not your fault too.
That's one of the things that I feel, and I don't want to push people to have more insurance, but I actually lowered recently my bodily injury because I had like 100, 300, and
yeah,
I had a little accident. I got T-boned. I was actually with Dr. Hutzel. Funny, I think you probably know.
Oh, really?
Yeah,
I do.
love him.
I do.
He's such a great guy. Yeah. Anyway, they gave me the ticket, which I was kind of frustrated about that, but I got it adjudicated because I know what to do and da-da-da. And of course, the lady wanted $100,000. And the guy who wasn't even in the car with the cane yelling, and you know where it was? I got T-boned at 5 Points intersection. So I turned into
That is the
5 Points
worst intersection in Jacksonville.
So I was going
cannot
through 5 Points, and they straight up T-boned me, and I got the ticket for failure to yield. It was crazy.
I still don't understand.
Yeah.
That process. Yeah. Every time I get there, I feel like I freeze, and I just wait. I'm like, okay, I'll wait till I go. But I can see that happening
because I just went and got smacked. Yeah. But she wanted 100, and then the guy who wasn't in the car waving a cane, yelling. They were old. He wanted $15,000 for lack of consortium. You ever heard of that word?
I was about to say I've never heard of that.
Yeah, he wasn't getting his. So he was suing me because he didn't get his lovin'. And I talked to the adjuster, and the adjuster knew who he's seen cases. So
yes.
I treat. Yeah. And you know what happened is I said, that guy gets nothing. And I looked at hers, and you know what, Mackenzie? She saw a doctor who treats auto right around the corner. He's a good physician. He's not a chiropractor, which is fine. She did MRIs. They showed degenerative stuff with kind of a flare of pre-existing. She went through the therapy. She did everything she was supposed to do. And you know what I said? Pay her, but not $100,000. I think she got 16 or 18 because you did what you were. And for me to don't pay her nothing, no, she deserves to get paid. And you called it. I don't agree that it was my fault, but she was hurt. She followed the protocol. She did the MRIs. She had the treatment. I would want my client to get paid if she was treating under me. So I said, you should pay her, but not $100,000. And he gets nothing. And I think she got 16, 18, something like that, which was a pretty fair settlement with just kind of exacerbation of pre-existing,
For sure.
I like to think that I can see it from both sides. But I lowered my, because I'm a target. So I went to 50. And I raised my uninsured from 10 to 25 because I said, I'm protecting myself if I hit anybody.
Yes.
But if I get hit, I'm done if they don't have insurance.
Yes.
Well, I said, I want my uninsured motorist at least half of what I'm covering if I hit somebody.
That's smart. I'm like, it's making me question too. Yeah. I know we have good BI, but now I'm like, I wonder what the UM coverage is.
Correct. Well, because we're protecting ourselves if we hit somebody. But if we get hit by somebody with bad coverage or no coverage, you're done. Especially if you got that ER bill I was just talking about.
That part, yeah.
Yeah. Ooh, I might plug my computer in real quick.
Uh-oh. No, you're good. Take your time.
So I guess that's kind of a plug for the insurance company, not what I was trying to do.
That's okay, but I think too, we see patients often where, they're recommended for surgery and they don't have UM, and there was just like a 10-20 policy
topic.
for the BI.
That topic,
it is.
That part of the conversation might be the most popular of this whole, well, just because if you've never really heard that, so many people do not understand un- or underinsured motorist. They just don't even grasp what it is and why it's important. But when you explain it like that, they go, well, that makes total sense. I want to take care of myself. If somebody hits me without insurance, I'm taking care of them with my insurance, And I'm assuming you guys see as well. I'm seeing some of the ERs are going crazy. Like, they're just pipectomies. I don't know if you've heard the term. I call it a pipectomy. You do like 3-4 CTs, it's gone. It is what it is.
It's gone.
And if I tell people, If an ER physician thinks you need a CT, I'm not here to question that. Now, if you got a $25,000 ER bill that found nothing, I may ask a couple questions. But I don't question, if you have headaches in an ER after an accident, get the CT. You have radiating arm pain, we were looking at red flags. You have severe headaches, you have concussive symptoms, you go get checked out. You have crazy sciatic, your fingers are burning and numbness, you go get checked out. You have chest pain, you have, you go get checked out. It is, I love what I do, but what I don't want is you show up to me and I'm like, you need to go to the ER. Which I've done that too. I'm like, I had somebody the other day. Yeah. Well, it wasn't a car accident. It was a fall, but the guy came in halfway through the exam. I'm like, you have to go to the ER. And he had a compression fracture in the spine.
Ooh, okay. Did he have radiculopathy?
And I think they think he might have cancer. So It was just one of those, too many flags, and I couldn't even get through the exam. So I tell everybody, go get checked out. Nothing can replace your health. So
that is a fact.
Yeah.
That is a fact. And to kind of tie this all as we wrap up, when I was talking to you about having all of, these specialists, having you and having physical therapy and having neurosurgery and orthopedics, pain management all together working as one, it's amazing, for these patients to have you as their chiropractor because there's so much trust, right? That you instill with them. And so when it's time for, maybe they're going to be coming to us for, let's say it's pain management or orthopedics or neurosurgery, they trust coming to Integrity because you have sent a referral. Let's just say if you did, send, a patient over to Integrity, they take that with the 100% trust because you are the one that's sending it over our way. And that's huge when it comes to the PI space, with a lot of times, like I said, these patients are seeing a chiropractor first. I mean,
well, and a chiropractor
with them coming to see you.
A chiropractor has a lot of responsibility.
A lot of responsibility
to do what's proper. And
yes.
I have concerns within my profession at times, for sure. And, but when you're working with companies that are always professional, like, Integrity, I'm not going to name other places, obviously, but, you just know that, you just know. I mean, the doctor knows that they can pick up the phone and call if they have a question.
Yeah.
You can drop an email and you're going to get me, It's not going to be some smoke and mirror. I remember Dr. Aquero? One of the neurosurgeons from St. Vincent called, I had a client who went to the ER a couple times, saw this chiropractor for 9-10 months. And it was she came in and she goes, it's either you or the ER again. I was sent to you. And I'm like, I got her feeling a lot better, but her sciatic didn't ease up. And I'm like, okay, we're going for an MRI. And it was just crazy bad herniation, up and down. And I was like, you are immediately going. I sent her to St. Vincent Brain and Spine. It wasn't auto as well. And he was so impressed that I didn't.
You had worked that up?
Well, and it was missed many places. And I, immediately she had surgery. She still comes in. But he called our office, and my office manager, Vicky, she's a bit of the, she's like half security guard, I swear. I'm like, be nice to people. You don't need to be that tough. But she's the lead blocker. I think you were the lead blocker for a while too.
Yeah.
You just got to okay, stay there. Doctor, go do your thing, or NP.
Yeah.
And I heard her, and she cut him off like he was advertised, like he was a marketer, which I hate that because we need our marketers. And I pop my head into my office. I go, did you just say Dr. So-and-so? And she goes, yeah. I go, you need to call him back right now. And he actually was like, will you bring stuff over to the office? I want somebody I can trust for chiropractic when it's not surgical, to see if you can get people better. And then if they get better, great. But then if they don't, get them back here. It was a very interesting, to me, those kind of things, that's elevating our profession. That's
Yes.
me being professional, doing the job the way it should be, recognizing who is a case for me, who isn't, and getting them out right away. Don't keep treating 3-4 months. And I firmly believe that by that being missed, that disc went up and down, and it was like crazy.
She had people advocating for her, along, for you to be able to find
She's an
something that was
attorney,
missed.
so she's kind of like, I don't think she wanted. I
Oh,
also
she didn't
think
want to know
she
an
was,
answer either.
I think she was also kind of like, I ain't got time for this. I just want to be better. But like, debilitating back pain changes your life. That's where accidents, that's where we come in. I mean, that's where chiropractic, I think a good chiropractor especially, or, several, you're kind of holding the case together. Obviously the attorney, but I tell people in the beginning, the doctors are doing this much, the attorneys are doing this much, and then it goes like this.
Mm-hmm.
So like we don't do much, and then the attorneys, it's like at the end is when they're doing all their work.
Yeah.
Well, you're doing work the whole time, but so anyway, it's very. Anyway, I'll stop talking.
No, you're okay. You're
What else do you have
okay.
on here that you wanted to ask?
Yeah, so I was gonna ask and see. Let me go back to my little questionnaire that I had. Um, just to kind of wrap it up, because I know before the first time I ever saw a chiropractor was actually when I was pregnant with our first.
Oh, that's
And
wonderful.
oh, it was amazing. And it made both of my labors insane.
You
The
see me
best that it could have
smiling.
been.
That
I know, you love hearing that. And honestly now,
I think
like,
that's
because
just
I've had
so awesome.
yeah, and since I had such an amazing, a time with doing that for both pregnancies and the outcome that came with that. Now with all of my friends who are pregnant, I'm like, please, it's the best thing that you can actually do while you're pregnant. But to say that before I ever saw a chiropractor,
It's a little.
there's always this, yeah, it's nerve-wracking, right? And people are always like, well, the whole, snapping of my neck and this and that. I feel like there is a bad cloud sometimes over chiropractic care. So
I
what would
mean,
you
you
say
gotta
to
be very.
someone?
Oh, what
You
was that? Go
do.
ahead.
But I was going to say, what would you say to someone who's kind of on the fence as far as, let's say they've had neck pain, lower back pain. They don't want to do injections, just get a surgery. They want to try chiropractic, but they're on the fence. What would you say?
Well, a lot of times with a patient like that, I would say you have to frame it where they decide that they want to try this.
Yeah.
You want to get them to commit, and I'll tell people, this is where chiropractors try to sell you this 2-year, $5,000 plan. What I tell people is, let's just see how you do. Let's do twice a week, 2 weeks, see if you're improving, see if you're feeling better, see if you're having a change in function. I tell people your pain going down is one thing, but did you feel more comfortable at work? Did you when you woke up, did you wake up at night a bunch of times from the pain? Were you able to take care of your kids easier? So there's pain and there's function. We want both to improve, but function improving is improvement as well. So I tell people, if it isn't working, we'll stop. And you can always go back where you were. You can always go, because if you're not getting better with me, we need to get you somewhere, because you need to get, a shoulder injury. Perfect example. You had fall, my shoulder's okay. And I'm like, well, move it. They're like, and I go,
Yep, it's probably already frozen at that point.
yeah. And I go, well, let's do this. I'm not getting an MRI. I'm not doing pain management. I'm not doing PT. Just fix it. You go, okay, well, let's give it 2 weeks, see how you function. Now, I understand with that, you got to do exercises. So I'm going to be talking about, resistance bands and basic stuff. But most of that conversation is going to say there's a high likelihood you are going to need an orthopedic consultation. They're like, I don't want to go to an ortho. And I go, well, these days, I can get you into a DPT, do like 8 sessions of physical therapy, see how you do. I mean, assuming the chiropractor, a lot of times I can help. I tell people with something like that, either you're going to get better pretty quick or it's not a me problem. And then they're like, well, I don't want to, I'm like, well, go try PT. With doctor to physical therapy now, you can get a group of visits covered without having a direct referral from an ortho or primary. And then that's kind of the segue. And then, well, it didn't get better with me. It didn't get better with that. Okay, well, let's get back to this conversation about getting to the ortho. Because I know the ortho is going to be like, well, you already did conservative care.
Exactly. That's like already the check.
MRI. It's either surgical or we need to try a steroid injection.
Yeah.
So I kind of guide people. If it's a me problem, you just get better. If it isn't, I kind of gently, and I say, well, would you rather try physical therapy first, or would you rather try the ortho and see what they say? Some people are like, juice me up, And now the big conversation is PRP.
Oh, I was going to talk about that as well, because we do that also in our office.
That's fantastic. So here's where I had to be careful not to fall behind the time, because in the beginning that was real all over and not consistent. That world has improved huge.
Yeah, tenfold.
And I tell people now, I've seen the results. I've seen the patients get better. And I can't say that if I haven't seen it. We can say it all day, it works and it does this, that, but I've seen my patients get better significantly. Falls with front and back labral tears. We're going to, they want to do PRP. And I'm like, PRP worker comp? Well, hey, it's covered, right? Sure, go do it. Let's see what it does. And the patient, the first two, they're like, ah. And then the third, they're like, it's gone. And I'm like, fantastic. Yeah. I think that is, I definitely, there's a couple things that if these existed when I was shadowing doctors, like the laparoscopic spine surgery wasn't there. So I love I was doing biomedical engineering. I was going to be designing that equipment. If I would have went in and I watched all these laparoscopic surgeries, I probably would be a surgeon. I just didn't okay, we're going to do
the big ortho
gallbladder, now it's just 3-4 holes.
Yep.
I really think I think there's a high likelihood that I would have moved into that. And I also think this regenerative medicine, if there was anything like what it is now, I love chiropractic, but I don't even know if I would have ended up shadowing, because I think I would have really liked the regenerative medicine. I talk to a lot of guys about men's health, for example, and, regenerative on that side, and just testosterone. I'm very lucky on that. And I said, I need to go through this in order to know how to tell other people what it's like. So I went in and had mine tested, and I was doing good. I actually didn't need any. I was like, it was like 665, and I go like, what was it when I was 20 if it's 665 now? There's part of my problem. But but I went through it, and I didn't do I didn't get into the peptide stuff and all that. I might, but I caught I've known this young man. His dad's a professional golfer, so they have it. But the kids grew up with my kids, and I noticed the son. I'm just like, I just knew something wasn't right, and I was like, I talked to the mom, and I'm like, hey, let's go get his testosterone checked. He's 19. It was like 200.
Oh.
And I'm like, I was like, okay, thank God I even had the wherewithal to put this into place. I'm not as good of a physician as I should be if I don't recognize that and get him out. His energy, just everything wasn't clicking for a 19, 20-year-old healthy kid coming from a very athletic family. Mm-hmm. So, now I think he's up to around 530, something like that.
Just from being on TRT and
Correct.
Stuff.
And he's like a different kid. But is that chiropractic? Not at all. But I needed to be aware and pay attention. So I think regenerative medicine and just dietary knowledge,
Yes.
The fuel if you want your engine to run well, you got to put good fuel in the tank.
The right food in your body.
I like these real palpable comments to tell people like that just resonate well. If you're not putting good fuel in the tank, it's not going to run well. And they go, well, of course not. And I go, what kind of fuel are you putting in your tank?
Mm-hmm.
Now, I don't want to be a nag, and I tell people, hey, see if you can go Monday to Friday. I talk probiotics. I don't even sell supplements. The supplement companies said I didn't sell enough, so I wasn't going to get the same discount. And I'm like, take your products, get out of here. You're not going to make me sell more stuff because and I bet you, and I go like, I bet you it's sold. It's sold. And then we'll just try to, yeah. So, but being a chiropractor, you have to recognize those things. And if regenerative medicine is, you have somebody with a shoulder injury and it's not that bad, and you don't tell them like, hey, look into this, see what you think, you're kind of doing a disservice, I feel. Yeah. I hate to say this with chiropractors, if you do the therapy, you love it every time. If you don't, you're like, just stay here. And I tell people, if you did that treatment, you'd refer it, then you should refer it even if you don't. Does that make sense?
No, it does.
If now a steroid injection is often good to do that, but a steroid injection is reducing inflammation and it repetitively degenerates a joint versus something that's put in to regenerate the joint. Mm-hmm. I think it's wonderful. I've even thought, because I actually have a laser medical clinic as well, so I do body sculpting, IPL, spider vein, stuff like that. I don't do it as much these days. I'm just busy. So like I've brought and integrated some of those things in as well, which I love the body sculpting. I think it's awesome. And I kind of really enjoy doing spider veins.
Yeah, no, I'm sure that's really cool to watch too.
Go away. Yeah, I should probably put that on the internet. People would probably.
No, you should. That. Yeah, I'm one of those people too that love stuff like that, especially like surgery type stuff.
I thought about live streaming a body sculpt. Yeah, like what the heck?
But you could definitely do that. But I think the PRP too, Dr. Rizek, if there's patients who are on the fence with surgery, and he gives them an option. Like, hey, you could do PRP first if you want. We can try that out. And then if not, then, we can kind of show you the other options. But it's nice that and all of our surgeons are like this, especially even with pain management. If there's something that they want to, start off with that's non-injections, maybe like shockwave therapy or something like that, we can do that. It's nice. It's up to the patient of, what they want to do.
Shockwaves, that's another interesting topic, actually, that I could probably talk to about. I've been finding that very interesting and looking at bringing those things in. I completely agree. And a lot of patients, not all, some patients just like, give me some drugs, give me a steroid, I'm good, needle in the spine, whatever, just make the pain go away. Other people are like, no, I want something more natural. I don't know if I call PRP holistic, but kind of.
It's part of your own body,
Yeah, I would call it just, more natural health care.
Yeah.
I don't know if I love the term holistic anyway, but they spelled it wrong. It's supposed to be WHOL, yeah. But I actually think the fact that allopathic healthcare is looking to give more holistic options, I think that is amazing. Mm-hmm. You don't have to go back very far, and it was either take the meds, do the surgery, or why are you here? I love the fact that we're having a conversation at an orthopedic pain management place. They're giving options that are holistic. That to me is advancement. That is progress. You know what they say, the opposite of pro is con, right? Mm-hmm. So the opposite of progress is Congress. That's funny, right?
No, that is a good one. No, it's funny too, because when we have our PRP days, I'm like a nerd in our procedure room watching everything spin and seeing everything that comes out of it. No, it is so cool. No, you actually can. We have PRP days. I was going to say one Friday a month. I think I'll text you. I'll let you know when the next one is. But
open. Yeah, I would love to do that, because what that would do is give me. I'd be like, I was there and watched it. When I say that to one of my patients who trusts me, they'll be like, really? Okay. Well, then let's go do it. Let's go take a look. I would love to do that. I think that's where I just want to be a better physician.
Yeah,
When
and
I
that's
hear
amazing. It
that,
goes to
yeah,
attest how you are as a physician, though, making sure that all of these decisions that you are making and where this patient goes, because ultimately it comes back to you. But to know, what process is in place that would be taken by coming to Integrity work out. But we
and
actually
the
had to buy
PRP has gotten a
two.
lot more cost effective too, if I'm not mistaken.
Yeah,
If you,
yeah. I mean, not bad. I think it's more so like the PRP kits that can, be a little bit more costly. But we had to end up buying another machine. So we had two PRP machines because, whenever it spins, it takes about 20 minutes. And so when we have, a full day of clinic of
yeah,
PRPs,
you gotta have.
we've got a nurse drawing blood here, then spinning that, then to the next patient. So it's just back and forth. But it really is cool to watch. So I'll have to text you and let you
I
know,
would
the
love
next time
that,
that we're going to
and
have an
all that'll
ortho
do is
day.
obviously, I'm glad we're having this conversation because I just need to get some patients over anyway. Yeah, 100%.
Perfect.
I don't, it's. Sorry, my sinuses are bothering me, but
No, that's fine.
I'm seeing too many of my referrals going to the same one or two places. I like sending to more places anyway.
Yeah.
To be
Yeah.
honest, all the marketing is gone. Nobody comes in and says anything to us anymore. So like, you just kind of end up in this little, and all the tracks with the big firms are like laid, like they don't play games, and the attorneys don't even know anymore. I mean,
I
I was
know.
talking to one the other day, and I'm like, well, if I send a client over, he goes like, I don't even get credit. And I go, what do you mean? And he goes, well, yeah, I don't even. That's not even how.
Yeah, it's completely different.
And I go,
Yeah.
what? You don't? Even if I send them to you? He goes, nope. And I go, huh. And then he didn't even realize that I'm not even getting referrals because I don't pay a marketing company. And he goes, oh, you don't? And I'm like, you don't have a clue, do you?
Everyone's so out of it. Yeah, no one has any clue. It's not like how it used to be where everything
Really?
was on top
And
of
it
it. You'd have the
happened so
pods that you could do.
quickly.
It really did. It really did. So I feel like everyone's kind of morphed into this new PI world, I guess.
Which I think that this is a good opportunity for integrity. I mean, I I think, and I want PIP to continue, but I have a
Yeah.
feeling with how all these changes, it's coming. Well, and
Oh, it is.
during COVID, it was on the desk of the governor. Thank
I know.
God he vetoed it.
I know.
But we're one session away from,
Yeah, it happens every year, I feel like. You know what I mean?
and the insurance company they're winning a little bit each time, and the bad faith, that was bad. That fundamentally changed how this process works, and it did not change it in favor of treating
No, it was not.
or
Mm-mm.
attorneys. It worked for the insurance companies.
Oh yeah, of course it did. No,
So
our CEO actually went to Tallahassee a few times. This whole tort reform and stuff like that was
awesome.
going on, but I mean, yeah, like you said, it's
It's a
coming. We just
different
don't know
world.
when it's going to happen,
I
I
think
think.
these connections are going to be more important than ever in the next few years because, you know, I take almost anybody, well, they have four CTs, well, I'm going to be waiting,
Yeah.
but I know we build solid cases. I know the physicians I work with do a great job. I know the attorneys I work with do a good job. So it's a waiting game, but a lot of the places
It
ain't
is.
waiting. So I do think there's going to, I don't want it to happen. I don't think it's a good thing, but I would say at the end of the tunnel, it's not the end of the tunnel, it's a train. And I think these relationships, long term, I'm so impressed to see the progress you've made.
Oh, thank you.
Yeah, that's wonderful. Well, you
Thank you.
need to do that. You have reached out. You know everybody. You need to be elevated because
Yeah.
you made those connections.
I mean, it was definitely like like I said, I've been here for 7 years, so I feel like
Yeah.
it's just been something that's slowly but surely built that way, and it is such a blessing to be able to know a lot of these people
I
in
think
this
the last time I
space.
saw an integrity event was the town center at Bahama.
That was a
Yeah,
that it was at
5 years
Tommy
ago?
Bahamas. It was
Yeah, 20.
2022.
Yeah. You just go, wow. I don't even know. Have you guys? Do you even have any more? I don't even.
No, the last little
Isn't that
event that
wild?
we had, no, it is wild because I feel like we were having one like twice or three times a year
Really?
in like in the very beginning whenever I started in 2019. The last little event that we had was like a CLE course for like attorneys. It was like a dinner and
Yeah.
learn type thing with Dr. Rizik, our orthopedic surgeon. But nothing like
It's
how
weird.
things were
So
before.
I like this because I'm now seeing everything is just going, and I always was sending to different people, and all of a sudden I just see everything, and it's not really because it's what I want. It's because like everybody just, it's just changed. And I'm on the outside kind of, and I don't even have a huge issue with that. Sometimes being on the outside it's just about perspective.
Yeah, it
Yeah.
is.
Well,
It is.
it might be raining on the inside, so it might be good to be on the outside. So it has been very interesting, and I feel like these relationships are just going to be more and more important as the time progresses. Anyway, so
Without
any
a
last,
doubt.
what do you got? Anything?
No, I think that was pretty much it. I want to thank you for your time. I know
Thank
that you've
you.
got stuff that you balance, and I knew that this was going to be a good podcast too. Whenever you and I were talking on the phone, and just,
I did
you
okay.
know, no, you did great. You did great. Obviously,
Not
you're
too
very passionate
cheesy.
about what you
Not my,
do.
my
Not at
proton joke.
all. No, no.
You know what a
I was like, it's
chiropractor's favorite kind of
Congress,
music?
right?
You know what a chiropractor's favorite kind of music is?
What is it?
Hip hop.
I should have seen that one coming, honestly.
Right?
That's amazing.
That's
All right,
terrible.
Doc. Well, thank you so much for all your time. I really appreciate it. And I'm sure we'll be talking soon.
I would love to, and thank you for the opportunity.
You
All the
got it.
best
Have a
to
good
you.
day.
Thanks.
You
Bye.
got it. Bye.